All right, time now to focus a little on health news this morning, and more importantly, health news for our teenagers and kids that have been living through this pandemic right along with us. And joining us once again from Johns Hopkins All Children's Hospital, Dr. K. So good to see you. I know you have been very busy, but we appreciate your time this morning.
Thanks so much for having me, Carly. We have been very busy. That is true.
So there's been a lot that's been said and studied and looked at about our physical health, and certainly for our kids, but mental health is just as important. What is it that you're seeing right now? And kind of when you step back and look, where are we at this point?
Yeah, we are at an interesting point right now, I would say. We knew we were in a mental health epidemic before we were in the COVID-19 pandemic. And we have certainly seen the uptick in the concerns in our teens and our children in regard to stress and anxiety, depression, increasing mood concerns, the adjustment, the uncertainty of everything surrounding the pandemic, which again, we knew was a concern before, but now more than ever, it has been highlighted for us. And we are really seeing our teens struggling in a lot of ways, especially not only as the school year wraps up, but also as we maybe see a light at the end of the tunnel in terms of the pandemic too.
You have an event that's going to, we'll talk about at the end of this. But before we get to that, what is the message for parents watching this morning?
Yeah.
What should they be looking for right now? How do you begin those conversations? Because I think, myself included, you want to be able to talk to your kids about it, but you don't want to also plant seeds and talk more about than what you need to. What say you?
Well, there's a couple pieces when it comes to communication that you've heard me say before that are so important. Make those times every day for communication. Put our cell phones down, have our kids put their electronics down too. And even if it's only 5 minutes, just a quick check-in of, how are you feeling? What's going on? And in those moments, we don't have to plant any seeds necessarily, but really asking those questions, being present without any distractions, such as our phones, which can be a really difficult thing sometimes, even for me. And then also, when we are waiting, wait in that silence. Let our kids kind of fill the silence with what's happening for them. And then when they are sharing things with you, take what they say seriously. As parents, it's often our role to fix everything and to come with the solution, because that's what we've done. We've raised our kids and we want everything to be great and we want them to be happy. But also we really need to acknowledge what they're saying. So especially if one of your students, one of your kids, your son or your daughter shares with you, I'm feeling down, I'm really stressed out. As a parent, sometimes our first response is to say, but you have a great life. You shouldn't feel that way. Why do you feel that way? Say, I really hear you. I'm feeling stressed out and anxious about things too. And sometimes my mood is down. Tell me a little bit more about that. So rather than coming at it with the solved problem, ask them for more. Ask them what else, and sit there, listen, and be present.
Oh, I feel like you spoke right to me, because that's my thing. I just want to fix it for them. Before we get into the details of this event, if you can, spend a couple seconds. What's your take home? What do you want parents to really understand this morning?
I want them to be monitoring their kids closely right now. There's a lot of changes. We've been through a lot. And as parents ourselves, I was just saying to my husband, I'm exhausted, and he's exhausted too. We have been as resilient as we can through all of this, but if there's one take home, it's 5 minutes a day, no phones, be present, monitor our kids, make sure that we're checking in and see if there's anything we can do to really be able to connect and communicate better.
Awesome advice. I love that. I need that reminded to me daily. All right, minute left. Tell us about this event and how people can help the great teamwork that you're doing.
We're so honored. For the first time, the Johns Hopkins All Children's Guild has combined with our Johns Hopkins All Children's Foundation to have a night for all children. It's the combined virtual event this year, so it's free and open to everyone. And the great thing here for me is that all of the proceeds go to the Center for Behavioral Health. We'll be highlighting a family who has had wonderful experiences with their Center for Behavioral Health and had mental health needs. And there's some fantastic silent auction and live auction items as well. If you are interested, and again, it's free, available to all, and of course, virtual. So hopkinsallchildrens.org/a night for all children.
All right. Well, make sure and put that website on ours as well. Dr. K, so appreciate you taking the time with us. And we hope that parents, again, I need those daily reminders too. So I appreciate it. Thank you, Dr. K.
Thanks so much.